Hi, my name is Samuel Scales. Today we're going to be discussing toxoplasmosis, which was my topic of infectious disease that I chose. So let's get right into it. So toxoplasmosis causation. Toxoplasmosis is caused by an infection of Toxoplasma gondii, which is an obligate intercellular protozoan parasite that can infect all warm-blooded animals. Its domain is Eukaryota. Kingdom Protista, phylum Protozoa, subphylum Apicomplexa, order Eucocydioria, family Sarcocystiae, genus Toxoplasma, and species Gondii. It's thought that more than 60 million people in the United States have been infected with toxoplasmosis. The two images that I have on the screen here, the top one is a representation of a bradiozoite cyst, and the bottom one is when it's in tachyzoid phase. So now let's talk about the life cycle of Toxoplasma gondii. There's three stages in this: the definitive host, an in-between phase, and then the final, which is in the intermediate host. So let's go ahead and talk about the definitive host. The life cycle within a definitive host, there's only one known definitive host for Toxoplasma gondii, and that is going to be members of the family Felidae, which is domestic cats and their relatives. The whole process starts when a cat ingests a bradiozoite cyst. That cyst is then going to be broken down in the stomach, and the bradiozoites are released. The bradiozoites will then move into small intestines and infect epithelial cells within the microvilli. Bradiozoites will then divide through a process called schizogony, which creates merozoites. Those merozoites will then leave and invade new cells, repeating the process. After several cycles of the schizogony is when gametogenesis starts. And that's where micro and macro gametes will go through a process of sexual reproduction and fertilization to create immature oocysts. Those immature oocysts are then going to move into the feces of the cat, where they're then excremented, and we'll move on to our next phase, which is that in-between phase. So in this slide right here, I have an image of an actual bradiozoite cyst within muscle tissue. I'm not sure what specimen this was taken from, but these are the actual cysts. Inside you can see the bradiozoites, and then it's surrounded by a nice thick cell wall. Now let's talk about step 2 in the life cycle of Toxoplasma gondii. This is going to happen in between the definitive and intermediate hosts. The immature oocysts are going to go through a process called sporulation to become mature oocysts that can spread infection. Step 1 in this sporulation process is the oocysts will divide and create sporocysts. Those sporocysts will then divide to create 4 sporozoites. Once those sporozoites are formed, the cells are now mature and infectious. The last step is going to be creating a cell wall to protect it from its environmental hazards, such as soil and water. The images I have on this slide are actually a picture of those mature oocysts. So now let's talk about the life cycle of Toxoplasma gondii within the intermediate hosts. All warm-blooded animals, including mammals and birds, can become intermediate hosts by consuming bradiozoite cysts or mature oocysts. Both methods will result in sporozoites or bradiozoites invading cells of the intestines and creating tachyzoids. These tachyzoids go within the body, further in attacking new cells. Once that happens, we have what's known as an acute infection of toxoplasmosis. They can move quickly through body cells and tissues, and they enter cells through a rupture secretion, which allows the tachyzoid to enter the cell. Once they are inside the cells, tachyzoids will go through a replication process called endodiogeny, and it's represented here on the right side of the screen. After replication, the tachyzoids leave the cell, which results in lysis of the cell, and they find new cells to infect. Common target cells of Toxoplasma gondii are associated with central nervous system, the eyes, and the heart. When the immune system reacts and starts to attack these tachyzoids, they will respond by turning themselves into bradiozoid cysts and surround themselves with a thick cell wall to protect them. So now let's move on to transmission. Modes of transmission for Toxoplasma gondii include oral, congenital, and other. Oral is ingestion of mature oocysts through cat feces, contaminated water, plants, and soil, or ingestion of bradiozoid cysts through undercooked meats, shellfish, cross-contamination through kitchen utensils. Also, ingestion of tachyzoids. Drinking unpasteurized goat's milk can result in the transmission. Congenital. A woman who has toxoplasmosis during pregnancy can pass the infection to her unborn child through vertical transmission. Other rare forms of transmission can include blood transfusions and organ transplants. I put the cat over on the left-hand side because they are the #1 spreaders of toxoplasmosis. How it causes disease. Toxoplasmosis has multiple forms of infection, acute and chronic. The presence of tachyzoids within the body is known as an acute infection, and this is most common among humans. The chronic is most common among immunocompromised individuals, and this is the presence of bradiozoid cysts. There's numerous infections associated with this chronic form, such as ocular toxoplasmosis and toxoplasmosis encephalitis. The fear with the chronic is that the bradiozoid cysts can become reactivated in tachyzoids when patients have become severely immunocompromised. This has led to research too over the last decade being that there's an increased interest in psychiatric disorders in toxoplasmosis, one of those psychiatric disorders being schizophrenia. It turns out in a report that I read that you are 3 times more likely to develop schizophrenia if you have a toxoplasmosis infection. The image on the left side of your screen here is the rear polar image of a retina that has been infected with toxoplasmosis. So now let's talk about signs and symptoms of toxoplasmosis. An acute infection, most people who will become infected with toxoplasmosis will be asymptomatic, but some may present with flu-like symptoms such as fever, tender lymph nodes, or muscle aches. In chronic infections, they can also present with flu-like symptoms. The ocular toxoplasmosis infection will result in vision loss, inflammation, sensitivity to light, and tearing of the eye. Toxoplasmosis encephalitis will be inflammation to the brain, will result in headache, fever, focal defects, seizures, mental confusion, issues with balance and speech, a lack of energy, and visual alterations. Diagnosis of toxoplasmosis. Diagnosis of toxoplasmosis is usually not needed because most people who are infected don't even know that they are infected. If a serious issue does occur, though, and detection and diagnosis is needed, then the typical testing is serologic testing. Serologic testing measures immunoglobulin G and immunoglobulin M. Diagnosis can also be made by direct observation from tissue samples from the cerebral spinal fluid. Congenital testing. Amniocentesis is the procedure done at 15 weeks of pregnancy. It's where the doctor goes in and takes a sample of the amniotic fluid and tests it for toxoplasmosis. Ultrasound can also be used to detect fluid buildup on the brain. Testing in severe cases, MRI may be needed to test for the bradiozoid cysts, or a brain biopsy may be needed if treatment of the toxoplasmosis is not responding well. They may take tissue samples from the brain to try to do further diagnosis and see if there's any effective treatment for the patient. On the left-hand side of the screen, we have an MRI, and that tiny white speck there is a bradiozoid cyst. Treatment. Acute treatment for patients with an acute infection. Most don't need a treatment plan, but some doctors may prescribe ibuprofen with pyrethromin, sulfadiazine, and these two medications are taken to treat malaria. Then we have a chronic infection. Same treatment as the acute with the addition of folic acid. And then for congenital treatment, we have spiramycin, which is a prenatal treatment. And then we have the same combination as the acute treatment, the pyrethromin and sulfadiazine. So treatment continued. We're going to be looking at ocular toxoplasmosis and cerebral toxoplasmosis next. They actually have the same exact medications for treatment, which is the pyrethromin, the sulfadiazine, the trimethoprim, and the sulfamethoxazole. Yeah. And then with the cerebral toxoplasmosis, steroids may be indicated if there is severe cerebral edema. And then with the cerebral toxoplasmosis, well, as well with the ocular toxoplasmosis, the neural imaging and imaging period should be done 2 weeks after a treatment to assess the effectiveness and how the patient's responding to the therapy. And again, as previously mentioned, with cerebral toxoplasmosis, if they're not seeing a change in the size of those cysts, then they may need to go in and take a brain biopsy to get their hands on the actual cyst itself to figure out a better diagnosis and treatment plan for that individual. Now we're going to talk about prevention. So prevention with food prevention, you can always cook meats thoroughly. Whole cut meats, beef and pork should be cooked at least to 145 degrees Fahrenheit. Ground meats, beef and pork, cooked at least to 160 degrees Fahrenheit. All poultry, cooked at least to 165 degrees Fahrenheit. Freeze all meats several days at a sub-zero temperature before cooking to greatly reduce infection. Peel or wash fruits and vegetables thoroughly before eating. Wash all surfaces and utensils after contact with raw meat, seafood, or unwashed fruits or vegetables. And do not eat raw or undercooked oysters, mussels, or clams. So prevention continued. Some environmental ways that we can prevent from getting toxoplasmosis is to avoid drinking untreated water, wear gloves when gardening and contacting soil or sand, keep outdoor sandboxes covered, feed cats only canned or dried commercial foods, ensure to change your cat litter box daily. If you are pregnant or immunocompromised, avoid changing cat litter boxes and have someone else do it for you. Keep cats indoors to prevent from hunting, and do not adopt or handle stray cats, especially kittens. Kittens are more susceptible to becoming infected because they're young. The best way to prevent infection is to consistently wash your hands and avoid touching your face and mouth. Teach everyone in your home, especially young children, the proper way to wash their hands. So that concludes my presentation. Today we discussed toxoplasmosis and how it's caused by Toxoplasma gondii, the life cycle of Toxoplasma gondii, transmission, how the disease is caused, diagnosis, treatment, and prevention. The last thing I wanted to wrap this up with is testimony of disease. Actually, myself, I had ocular toxoplasmosis. I am a landscaper by trade and became infected. This was about 3 years ago. I went immediately over the course of one day. I think I lost almost complete vision. It was kind of like everything was closing in, and I had very tight tunnel vision. Um, so, in a panic, I went to my ophthalmologist. He took a look at it, was very concerned, sent me to a retinal specialist. retinal specialist was pretty confident that he knew what it was, but he wanted me to go to an infectious disease first. Sure enough, tested positive for antibodies for toxoplasmosis, and I hopped right onto a treatment plan. I received about 6 injections straight into the eyeball. That was quite nerve-wracking and a little painful. Um, and I also was on a treatment plan from the infectious disease clinic, and they put me on some round of antibiotics. I can't remember off the top of what it was. But it took about 2 months, and I started to get my vision back. But the damage that did was irreversible. I still have a loss of peripheral vision, and actually a year after the incident, my retina became fully detached due to so much damage that the toxoplasmosis has caused. Um, but that was treated as well by the same retinal specialist. Um, but here I am today. I can see out of the eye. Like I said, loss of peripheral vision, but at least I can see. It's not the best, but hey, man, I'm just thankful to be alive. So, thank you so much for your time today, and that's all. Here's my reference list of resources that I used while working on this project.